Alright, so this is the end of the story of nephrotic syndrome. In this video I'm going to talk about the complications of nephrotic syndrome, okay, and the treatment of these complications. The first and the most important complication of nephrotic syndrome is the presence of serious infections. Serious infections like what? Like bacteremia, okay, or peritonitis. Peritonitis is very important and very common. Nephrotic syndrome, okay. The infection of nephrotic syndrome is due to the loss of IgG, okay. The proteins will be lost in the urine, so the loss of IgG will lead to serious infection and the chronic usage of steroids. You will see that most of the complications of nephrotic syndrome is due to loss of important elements in the urine. If we lose the IgG, then we have serious infections, okay, particularly Streptococcus pneumonia infection, the E. coli and the Klebsiella. Okay, some say that pneumococcus also is important infection. Okay, so the loss of coagulatory factors like protein S, C, and antithrombin 3 plasminogens, okay, will lead to a hypercoagulable state. Okay, hypercoagulable state, because these coagulation factors will prevent the coagulation. Okay, if we lose these factors, we will have a hypercoagulable state. Okay, we may have cavernous ischemia and the cavernous sinus ischemia or hemorrhage. Okay, this will lead to increased risk of thromboembolism. How to treat that? With warfarin, Lovenox, and low dose aspirin. Okay, you can use them to treat thromboembolism. So when to give these agents? In previous thromboembolism event, or if you have a patient with high risk of thromboembolism events, like if he is a hyperlipidemia, okay, and so on. Diarrhea and diuretics use, this is diuretics, just diuretics, okay, use will lead to hypovolemia, and this somehow will lead to hyperkalemia in some cases. Okay, how to deal with hyperkalemia? If we have below 7 levels, then we have to do ECG. If it is there are changes in ECG, okay, then we treat. If we have above 7, we treat directly, because of course we will have ECG changes. Okay, so we treat directly. Below 7, look at ECG. Above 7, treat directly. Also, I told you in the previous video that when we lose proteins, okay, the liver will try to compensate the loss in these proteins, okay, by producing proteins, and the byproduct of this mechanism is increase in lipids like triglyceride, cholesterol, and so on. Okay, so we will have hyperlipidemia. How to deal with the hyperlipidemia? Statins. We give statins. Sometimes we can have iron deficiency anemia, okay, vitamin D deficiency. Okay, so these are the complications of the nephrotic syndrome. Remember always to think about what we are losing. Okay, we are losing IgG, then think about the infection. Losing the coagulatory factors, then think about thromboembolism events and the hypercoagulable state. Okay, if we have diarrhea, if we use diuretics drug, think about hypovolemia and hyperkalemia. Okay, vitamin D deficiency, iron deficiency anemia, hyperlipidemia as a compensatory mechanism. So think about them all. Sometimes they think that giving prophylactic antibiotics will be beneficial, okay, and this is only if we have a huge edema or a huge loss of proteins. We give a prophylactic antibiotics. Okay, so this is all about the nephrotic syndrome. I hope it was beneficial. Let's start with the definition of nephrotic syndrome. pathogenesis of nephrotic syndrome, the etiology, primary or secondary nephrotic syndrome, the minimal changes, focal, segmental, membranoproliferative, membranous, the mechanism. Again, I use this picture. Okay, the clinical manifestations of nephrotic syndrome, the diagnosis of nephrotic syndrome, proteinuria, the readings of protein urine, the hypoalbuminemia, the hypercholesteremia, C3 complement when it decreases. Okay, the treatment of nephrotic syndrome depends whether we treat the disease itself or treat the symptoms of the condition. Okay, and finally we ended up by treating the complications of nephrotic syndrome. Thank you very much for watching this. See you in the next video of pediatrics.